to the next commencement matter, and that is Senator Tom Clonan. You've got 4 minutes.
Is the Minister going to be here?
No.
OK, so I was informed it was going to be Minister Abbott. OK, and do you have a response, Minister? You do, OK. So can we just start the clock? Apologies. So I'm here to speak about the despicable practice by HSE, that's Health Service Executive, Disability Service Managers, who are refusing to allow disabled citizens to avail of independent, what the Minister herself, Rabbit, calls enablers, to allow people to have autonomy and choice in personal assistance. So I have 2 examples in CHO6 where this seems to be a particular problem. One family, their son went to London in 2019 and suffered a traumatic brain injury. He's been returned to them over COVID and has no personal assistance. He's 29. You know, he goes off to London with his whole life ahead of him and returns with a traumatic brain injury. And unlike the support he got with the National Health Service and the assistance that he got, there is nothing for him here. So he's at home with a traumatic brain injury with his parents. There is funding for 40 hours a week, but the Disability Service Manager in CHO6, Dunleary Rathdown, on her own cognizance says you can't use an independent enabler, you must use an aged healthcare provider, for example, you know, like rehab or whatever, which is completely inappropriate to his needs. Now, Minister Rabbit has instructed at a meeting of last May that the HSE facilitate disabled citizens in this way. But I'm getting increasing correspondence from disabled citizens all around the country whose disability services managers on an idiosyncratic, capricious manner are saying, no, you can't use that service, you must use the service that I choose for you. And this resides in a charity-based model of disability, and I'm sure my guests from Germany will be shocked to hear this, because in Germany they have a rights-based approach to the provision of independent supports for disabled citizens. I have another case, Lisa Domican, who was actually here for the last commencement matter, and I'm disappointed to note that yet again Minister Donnelly has failed to turn up here to give an explanation or an answer. She has 2 children, Grace 24, Liam 26, both suffering from autism, epilepsy, PMDD, anxiety disorder. They're at home, they've no supports, no care, and again they will not allow Lisa, their mum, to use the independent enabler to have their own autonomy and their independence. And then I get a letter from a beautiful lady. I'm going to call her Blahin because I don't want to give her real name. She's 86, Minister. Her husband is 88 and uses a rollator. Their daughter got a brain tumour in 1970 when she was 3, and they have no supports. Blahin tells me in this letter, you can see her beautiful handwriting, she got cancer 2 years ago and is just recovering and is not allowed, she's not supposed to lift anything. But in the wonderful Ireland of 2024, she's expected to lift her 58-year-old daughter out of her wheelchair and into bed every day. And yet again, there is funding in place provided by people like Minister Rabbit, but the HSE refuse to allow them to use an enabling broker to have their independent PA service. So this is can you imagine an 88-year-old man on a rollator and his 86-year-old wife, who's a cancer survivor, expected to lift their 58-year-old daughter in and out of bed? I mean, I'm ashamed of what's happening in this country. And you would think after the care referendum, where over 1.2 million Irish people voted to have independent supports outside of the family for disabled citizens. So I want to know, why are HSE managers bullying families all over the country in this way, bullying disabled citizens? And why are they allowed to get away with it, despite the explicit instruction of Minister Rabbit and Minister Donnelly that this be otherwise, that they have a rights-based, independent, autonomous set of supports? Gura Mahagov.
Senator, Minister, 4 minutes.
Thank you very much, Senator. I wish to thank Senator Clonan for raising this important matter today, which I'm taking on behalf of my colleague, Minister Rabbit. The Personal Assistance Service was developed to provide a service for adults with physical disabilities that enables them to live their lives as independently as possible and take decision-making control. The person with the disability determines the support they need and the activities they need support with. Typically, PA services are delivered through some Section 38 and mostly Section 39 organisations who have service level agreements with the HSE. As part of the HSE-wide requirement to ensure appropriate governance arrangements that underpin the release of the funding of agencies, a governance framework for funded agencies has been developed which ensures a consistent approach in this regard. The HSE must have in place appropriate contractual arrangements, service arrangements and grant aid agreements with all agencies that have funding released to them for the provision of services in accordance with Section 38 and 39 of the Health Act 2004 and in FRB 6. The framework was established to implement the legislative provisions of the Health Act 2004 and to reflect the requirements for public accountability where the HSE is legally obliged to account for all public expenditure on health and personal social services. The framework seeks to provide a level of governance which links funding provided to a quantum of service and provides for these services to be linked to quality standards with continuous monitoring to ensure equity, efficiency and effective use of available resources. Home Care Direct Limited is a private company set up September 2012 and operates a recruitment platform for disability service users to access personal assistance home care staff. Minister Rabbit met with Home Care Direct in May 2023 in relation to personal assistance. At that meeting, personalised budgets were also discussed as a small number of individuals are availing of personal assistance services outside the traditional service providers pathway as part of the personalised budget plan. The pilot is trialling 3 different models of how personalised budgets may be assessed by people with disabilities. A person managed fund, often referred to as a direct payment model. This payment option attracts particular legal and financial responsibilities for the individual, including administrative and employee management responsibilities. The second one is a co-managed fund, which is B, is a co-managed fund with a service provider where the funding is paid directly to an existing HSE contracted service provider, with services provided based on an individual's choices and a decision is detailed as their personal support and spending plan. And C is a broker management fund where a broker would support a person to manage their personalised budget with terms and conditions set out in a contract between the person and the broker. In practice, this model would also require a service agreement to facilitate the disbursement of funds. Home Care Direct confirmed at that meeting that they did not wish to enter into a service level agreement with the HSE, and it was agreed that their business model fell more in line with a direct payment model. I understand that the Senator met with the HSE in February, and it was confirmed that the only mechanism for the disbursement of exchequer funds to provide a private service provider was via the service arrangement process. If Home Care Direct wished to engage with the personalised budgets pilot outside of the direct payment model, Minister Rabbit would encourage them to liaise with the HSE once again, who are happy to support them in developing documentation to ensure they meet the standard of a service arrangement.
Thank you, Minister. I'm disappointed to note in the Minister's response that it really doesn't answer the question or meet the needs of the people who have contacted me. And it is essentially not the case that direct payments can only be made through a service agreement. It is common practice throughout the HSE in community healthcare organisations all over the country, and particularly west of the Shannon, that companies like Home Care Direct facilitate independent supports for disabled citizens. So it is not correct to say that this is the only mechanism by which direct payments can be made. But I would appeal to you, Minister, to impress upon Minister Rabbit and Minister Donnelly that I'm getting correspondence like the letter from Blaheen every day. People are in absolute crisis, and it is a very easy fix. I note that the Minister seems to have rowed back somewhat on her position, where she would ask her colleagues in the HSE to actually facilitate families. I mean, this is what we're about. We purport to support the independent human rights of disabled citizens. We had a very expensive government campaign which said that disability rights are human rights. So can we see some action on this? And I appreciate your response, Minister, and I would like to just conclude by, again, echoing the congratulations from our fellow senators, and cogorgeous and well done.
Thank you, Senator. And I too have come across very similar cases to what you're talking about, so I very much understand the challenges that are there. Can I just finally say that I would like to thank you, Senator, for raising this important issue for discussion today. It is acknowledged that there are differences in the delivery of personal assistance services around the country. The Action Plan for Disability Services 2024-26 commits to a policy review of personal assistance services in light of UNCRPD, with a working group involving key stakeholders and disabled people's organisations. The Senator may be aware of the Personal Assistance Review Group being established by the HSE. The purpose of the PA Review Group is to develop a protocol for the eligibility and allocation of PA services based on a universally agreed definition in collaboration with the Minister's Department, people with disabilities and providers. The terms of reference to the group are to carry out a comprehensive review of current personal assistance service delivery, identification and evaluation of best practices in personal assistance services from national and international contexts, an examination of the legal and regulatory framework governing personal assistance service in Ireland, identifying any gaps or areas of improvement and providing recommendations for legislative policy or changes, and finally, a comprehensive report outlining a roadmap for the improvement and enhancement of personal assistance services. In respect of the personalised budget demonstrator project, it is expected that the pilot will move towards evaluation in 2024. And I do accept what you're saying, Senator, in that we are the number of people. We have a growing ageing population. Within 5 years, it's going to be over 1 million people, and we will have more challenges. Therefore, it's important that we have the correct structure in place as well.
Thank you, Minister. Now we'll move on to